And in your health news, we have heard of several instances lately of people telling us that they now need a prescription to get an updated COVID-19 vaccine. Melissa Hippolyte took that question to the Virginia Department of Health and has an update on what the current guidance is and when that could change.
I wanted to get it done as soon as possible.
In May of 2021, 13-year-old Madeline Rose got her first of 2 COVID-19 shots. We talked to her on that day, which was the first full day kids 12 to 15 could get the Pfizer vaccine.
I'm not a huge fan of shots, so I'm glad it's over, but I'm also really glad that I got it because I think everyone needs to get this.
Fast forward more than 4 years later, and her mom, Brittany Rose, says she, Madeline, and the rest of her family want to get their 2025-2026 COVID-19 booster shots, but the process is suddenly harder. Rose says she stopped by her local CVS a few days ago and inquired about the COVID-19 vaccine.
I asked if they had the updated COVID vaccine available, and they confirmed that yes, they did, but that it couldn't be given without a prescription from our doctors.
Rose says she and others in her family never needed a prescription before to get a COVID-19 booster, and she was taken aback.
Because if you then have to make an appointment and go to the doctor and pay a copay to see the doctor to then get a prescription, then to go to your pharmacy, those are a lot of hoops to jump through.
We asked the Virginia Department of Health why that may be. They say there are 2 ways to get a vaccine in Virginia. The first is under the direct authorization of a medical provider, i.e. through a prescription. The second is by following the Virginia Board of Pharmacy's statewide pharmacy protocols. Those protocols permit pharmacists to administer vaccines based on the CDC's immunization schedule. Currently, that does not have guidance on the latest formulation of the vaccine. In late May, Robert F. Kennedy Jr., the head of the Department of Health and Human Services, announced with the head of the National Institutes of Health and the head of the Federal Drug Administration that the COVID-19 vaccine had been removed from the CDC's recommended immunization schedule for healthy children and healthy pregnant women.
Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We've asked VDH why folks outside of those 2 groups cited by Secretary Kennedy, healthy children and healthy pregnant women, still have to get a prescription for the vaccine. We are waiting for a response. The CDC's Advisory Committee on Immunization Practices is scheduled to meet on September 18th and 19th to vote on the updated COVID-19 vaccines. If approved, pharmacists will be able to administer the updated COVID-19 vaccine. But Rose says she feels uneasy about what they may decide.
But I'm not confident. I'm concerned. This is going to be a real barrier to health care for a lot of families in the Commonwealth.
Several states have moved to allow pharmacists to administer the updated COVID-19 vaccine without a prescription. We asked Governor Glenn Youngkin's administration if he was planning to do anything similar. A spokesperson said the administration will consider addressing the outstanding issues once the CDC's Advisory Committee on Immunization Practices meets on September 18th and 19th. In Richmond, I'm Melissa Hippolyte, News 3.